Did you know you're supposed to be brushing your dog's teeth daily in order for you to prevent tartar buildup? Dogs' oral hygiene is similar to ours. We need to maintain it in order for it to stay healthy. As someone that works in the veterinary field, I have seen a lot of dogs that come in with a bunch of tartar buildup because owners neglected to do some of the preventatives that intakes in order for you to prevent a lot of tartar buildup. Today we will be talking about some of the problems that occur if we don't upkeep with our dog's oral hygiene, as well as what are some of the causes and some of the solutions that we are able to do to address this issue. I have attached a picture down below. It shows the cavity of a dog's mouth, and it is an example of what your dog's teeth could look like if you don't maintain the dental hygiene. An article published in 2020, it talks about periodontal disease being one of the most common diseases in dogs over the age of 3, with reported popularity ranging from 80 to 89%. This is the same article that talks about smaller breeds developing periodontal disease earlier compared to larger breeds. Another problem is isolating periodontal disease to just the oral cavity versus it affecting other diseases such as renal, hepatic, and cardiac, like it is mentioned in the article published in 2020. In this same article, it talks about not all studies agreeing that there is an association between these, but think about it. If all this bacteria that is landing under the gum line is traveling through the bloodstream and it travels to the other organs, how is it not affecting it? So now let's talk about the causes. One of the main causes is not being able to brush your dog's teeth. Another one is their breed, and as well as the food that they intake and some baby teeth that could be retained. In an article published in 2020, it states approximately half of the dog owners in a survey never brush their dog's teeth, and almost 1/3 of them brush it less than once a week, and some of them just did it on special occasions. In an article called Dogs in the Chair, it talks about typical dental calculus. It seems to be more affected in smaller dogs. For example, poodles, Bichons, rat terriers, and you ask yourself why are these breeds more predisposed? Well, the tinier the breed, the smaller the food that they consume. Sometimes a lot of owners do some wet food for smaller breeds, so they're not using their mouth as much to help kind of scrape the calculus off. In the article that I mentioned before above, it talks about some dogs retaining baby teeth as well, which causes crowding in the mouth and along the gum lines and the permanent teeth. So it doesn't give them a lot of space for them to be able to use their food to kind of scrape, or toys to kind of scrape that tartar off. So now let's cover some of the solutions that involve preventative care. The main one is obviously brushing their teeth daily. In an article published in 2020, it indicates in dogs as well as in humans, daily toothbrushing is considered the gold standard to prevent periodontal disease. In the article Dogs in the Dental Chair, it talks about the plaque mineralizing into calculus in 24 to 48 hours, which is why it's vital for you to be brushing your dog's teeth daily in order for you to kind of help prevent any tartar buildup. Besides brushing the dog's teeth, we also could talk about some dental chews. Like it mentions in the article published in November of 2019, dental chews of various size and shapes with or without anti-calculus agents has demonstrated to be one of the easiest methods to remove any buildup. I personally use 2 different kinds. One of them is Oravet and the other one is a TD treat. Let's watch this clip on the Oravet treat first. Now that we watch this video, like Dr. Ed Lehan mentions, these treats could reduce some of the tartar buildup. This is a great way to help your dog prevent them from having a bad oral hygiene. Even though they may seem to be a little bit pricey, like Dr. Ed Lehan mentioned, it will be cheaper than having to do a dental procedure. Now let us talk about the TD treats. As it is stated that on the Hills website, the TD treats contain matrix of fibers which act like a toothbrush and to scrub the teeth to remove the bacteria, which is the reason that it kind of helps instead of brushing the teeth, if that's an option that you don't want to go through. Lastly, let us talk about something that most owners dread, since it's a little bit expensive and they don't want to be involved with having to put their animal under anesthesia. In an article published in 2019, the removal of tartar with mechanical brushing, which intakes the dental procedure that I mentioned, will be the recommended by your veterinarians as your pet gets older. If you want to avoid all this, obviously it's going to have to be intake at some point of their life, but if you're able to push it out longer, that's probably for the best. Just like we get our deep cleaning, sometimes our pets need their dental procedure. Now that we discussed the problems and causes and the solutions of a tartar buildup, it is time to decide what type of owner you want to be. Owner A would be brushing daily and or avoiding, or giving treats. And owner B would be spending hundreds of dollars doing dentals to help prevent the oral hygiene. Which owner will you be?